And let me give you a pretty good clarification of both ends of the spectrum. If you're an employer who offers a set of benefit packages to all levels of employees, regardless of class, they all have access to the same plan designs, and your contribution is structured equally for all your classifications, you should not have a 105H concern. If you're already self-funded, you should already be in compliance, because 105H was issued in the 1970s and is applied to self-funded plans since then. If you are a plan who perhaps covers 100% of the premium for highly compensated employees and 50% for non-highly compensated, you need to get some advice in terms of whether you'll pass 105H testing or not. If you're a plan in the hospitality industry where you cover management only, and let's say you have nationwide a couple of thousand management employees, but across the country you have 25,000 other employees who aren't in classes of eligibility, you may have a 105H concern because access is being restricted to what might be deemed to be highly compensated or a higher class of employees. So it's very specific to each employer's circumstance, and if you have any question about that, I would suggest you work with a resource that can do the 105H testing so that you'll know if that's going to be a concern for you going forward.
One report I saw recently indicated that within the first year after the implementation of health care reform, they estimated that 1/3 of all companies that are providing insurance would lose their grandfathered status, a second third in the next year, and a third in the next year. And so they were estimating by the time we're 3 years into this, everybody's going to have lost grandfathered status because it's so hard to hang on to.
And depending on what those final regulations look like, it may be 2/3 in the first year. So we'll have a better idea hopefully the middle of next month. Just one item I want to cover on this particular slide so we can keep everything moving forward in the interest of time. There is an opportunity to revoke. And what I mean by that is if you were to trigger a loss of grandfather status inadvertently before the regulation clarifications were issued, primarily if you are an April, May, June, July, August, or September anniversary, you triggered loss of grandfather status unintentionally because the regulations weren't issued yet, you'll have an opportunity to revoke those changes. Now, realistically, again, this opportunity is probably a little bit of smoke and mirrors because let's think about changing insurance carriers. So if your anniversary was June 1st and you moved from one insurance carrier to the other, your ability in 2011 at that anniversary to unwind that doesn't exist. You could go back to that other carrier you were with June 1st of 10 or prior to that, but you wouldn't get the same benefit design exactly, and you wouldn't have the same premiums. So it's probably not realistic to go through revocation. Again, it's a process of evaluating how important would it be to go through that process and what you'd have to comply with in order to do that. But the legislation does include the clarifications, instructions, and opportunity for employers to go through that process in 2011. You get a bit of a free pass until 2011 should you have revoked your grandfather status or triggered your grandfathered status unintentionally. So with those comments, we're going to go through the timeline, a high-level overview of provisions, some of them which we've already discussed this morning. We're going to talk a little bit about some of the tax implications and try to move you up to the 2014 timeline. So Terry, you want to?
Sure. In 2010 and 2011, as we previously mentioned, the legislation calls for removing the exclusion on pre-existing conditions for people under 19. So that means that children of your employees who have pre-existing conditions, that will no longer be subject to the same kind of exclusions and limitations that previously existed. As Karen mentioned, later on this is going to be expanded to cover everyone, but in this time frame it just covers the folks who are age 19 and under. In terms of the coverage for dependent children, which now is available until they reach age 26, that provision used to say they had to be in college or that they aged out when they were 23. Those are no longer required. So be sure if your plan said that they had to be a full-time student or language to that effect that you get those taken care of. As Karen mentioned, it previously required them to be unmarried, and that is no longer the rule. The regulations suggest that you do not have to cover the dependent child's child. You don't have to cover your employees' grandchildren under this new provision, but those dependent children up to age 26. There is also a new program that's available to employers to recoup some costs they've been paying for benefits to early retirees. If your company has retirees between age 55 and 64, they're not yet eligible for Medicare, and you're paying some kind of benefits to them, then there is a program available where you can recoup some of those costs. They've set aside $5 billion for this program, and it continues either until January of 2014, when everybody will have insurance available through other means, or until all the money is gone. They just recently put out the regulations that specify how employers who've been paying these benefits have to apply for that reimbursement, and the regulations are about an inch thick. And there are all kinds of requirements that you have to represent that you're using these funds for certain kinds of programs, and that you know you're going to meet this test and that test. And I think in the long run it may be a process that is so complicated and so time-consuming, with so many potential pitfalls for employers, that many folks who are and have been providing those early retiree benefits are just going to say, it's not worth it, and move on down the road. Now, I think the early retiree benefits program is not as significant as it used to be. I used to have lots of clients who would pay benefits to early retirees to kind of bridge them over from that early retirement age until they were eligible for Social Security and Medicare benefits. Those programs seem to have kind of fallen by the wayside, and I don't see as many of those as I used to. But if you are an employer who's hoping to be able to recoup some of the money that you've paid for those kind of programs, that is a allotment of money that's going to be drawn down, and so if you're needing to do that, you better get moving on it. The estimate for filling out the application, according to the regulations I've seen, is approximately 25 hours, so it's not an easy thing to get. As I mentioned earlier, there is going to be this external appeals process that we don't really know what it's going to consist of. That regulations will be fleshing out as we move through that. The preventative care, there's going to be a new federal task force to determine what that is and what it consists of. We do not yet know what the complete list of preventative care items is going to be.